The Ministry of Health, Wellness and Elderly Affairs has taken a decisive step toward shaping the future of healthcare in St. Lucia with the hosting of a high-level validation workshop to advance the finalization of the National Strategic Plan for Health 2025-2035 NSPH. Held on Tuesday, September 16th at the Bougainvillea Conference Room Bay Gardens Hotel, the workshop brought together key partners and stakeholders in health development. Supported by the Pan American Health Organization PAHO and the World Bank Group, the session formed part of a series of stakeholder engagements launched in 2024 aimed at creating a health sector roadmap that is both inclusive and transformative. The NSPH 2025-2035 will serve as a comprehensive, forward-looking framework to guide the delivery of health services over the next decade. With a strong focus on resilience, equity, and people-centered care, the plan is being carefully aligned with global and regional commitments, including the Universal Health Coverage UHC strategy, the Sustainable Development Goals SDGs, and the Essential Public Health Functions Framework EPHF. Permanent Secretary in the Ministry of Health, Wellness and Elderly Affairs, Jenny Daniel, emphasized that building a strong health system requires a clear strategy, one that defines the goals, the people it is meant to serve, and the path to achieving lasting results.
This strategic planning process is very important. Of course, we know that we can implement various activities, we can have goals, we can have objectives, but if we don't have a strategy of knowing what we would like to do, who we would like to do it for, and the way in which we would like to conduct our health services here in St. Lucia, then we will not achieve. We also need to keep in mind, of course, how we will know when we would have achieved our objectives. And so all of this is going to be discussed today. And of course, we have our partners, the World Bank Group. We have the Pan American Health Organization, both of whom have been very instrumental in getting us to this point.
Solange Kobe Jackson, PAHO advisor for Family and Life Course in Primary Healthcare, explained how PAHO's collaboration with the Ministry of Health is significant in ensuring that St. Lucia's strategic plan is built on solid foundations.
PAHO has been working with the Ministry of Health very closely. We work on first of all, on assessing the essential public health functions that leverage or give us some priorities that will be considered for this national strategic plan. So the essential public health services we work on will provide us like a path to have a national plan that provides standards of care, standards of guidelines to St. Lucia.
According to the senior health economist for the World Bank, Edith Villeni, this process marks a pivotal moment for the World Bank, one that brings St. Lucia together to not only design a plan, but to take ownership of its health future.
Your last national strategic plan was between 2006 and 2011, and this is a fantastic opportunity to convene to create a new national strategic plan for health for St. Lucia. This strategic plan, the validation session of this, is a unique opportunity for the Ministry of Health, all of the stakeholders and also the partners to come together, not just to have a strategic plan, but indeed to create ownership within the country for your strategy.
Upon completion, the strategic plan will set clear priorities for St. Lucia's health sector, ensuring that policies, resources, and initiatives are effectively coordinated to meet the needs of the population. It will also reaffirm the ministry's commitment to providing access to quality healthcare for all, while strengthening the health system's capacity to withstand future challenges. From the Communications Unit of the Ministry of Health, Wellness and Elderly Affairs, I am Onika McCoy reporting.